Switching gears a little bit now to high blood pressure. High blood pressure, we have medicinal and non-medicinal options for treating high blood pressure. Usually, if the blood pressure seems to be a stress-related issue, I try to talk to you about stress modification techniques, coping mechanisms, that sort of thing. And if medications are needed, there are a plethora of medications that we can reach for to easily control your blood pressure. In taking care of patients with high blood pressure, I also like to see if the high blood pressure has had any deleterious effects on your heart. So I usually will obtain an electrocardiogram, which is the electrical tracing of your heart, as well as an echocardiogram, which is an ultrasound of your heart, where that tells me your heart's pumping function, the valve function, as well as if the high blood pressure has made the walls of the heart to be thick. If it has not done so, then we like the buck to stop there. We do not want it to progress into any sequelae of hypertension, but if there are sequelae of hypertension, we try to control them as much as possible. Touching on valvular heart disease can affect young and elderly people. I like to say to my patients that valves are like doors that open to allow blood to move from one room to another room in the heart. And if they open well, excellent. If they close well, excellent. Valvular heart disease can sometimes occur if the valve is too tight or if it does not close all the way. These may produce certain symptoms for you, such as chest pain, shortness of breath, palpitations, and typically an echocardiogram will be the test of choice to assess exactly what valvular issues you may have and how best we can treat it. Again, I cannot underscore that cardiac rehabilitation, even for valvular heart disease, is an excellent tool that we have now and that we can make use of in promoting effective cardiovascular lifestyle. Lastly, I want to touch a little bit on heart failure. Heart failure is a very broad topic, and it has both heart failure with strong hearts and weak hearts. The weaker hearts are, we know very well, medications that can improve the heart function. We try to promote effective salt and fluid intakes. For example, if you do have heart failure with a weak heart, you may see us telling you to limit your amount of salt and water to no more than certain prescribed limitations by the appropriate societies. We try to typically improve your quality of life to make sure you are not at risk of any bad heart rhythms, as well as to keep you out of the hospital. It's my firm goal that if we can keep you out of the hospital as a heart failure patient, we have done you a reasonable service. Heart failure with strong hearts is a little bit more difficult to treat, and we try to generally control your blood pressure to see if there's anything reversible or genetic that we can find that we can modify to treat your overall process. But we do fundamentally try to improve your lifestyle through adequate blood pressure control, salt and water intake, as well as to get you as symptom-free as we possibly can given the circumstances. So treating heart failure is one of the more challenging cardiovascular issues, but if patients do feel well, it can be one of the most rewarding.